Hello, my name is Dr. Zwelling, Marcy Zwelling. My patients call me Dr. Z. I'm an internist, I'm an emergency room physician, and a critical care physician. And I'm proud to be my patient's doctor, and as proud to serve as this year's president of the American Academy of Private Physicians. Let me tell you a little bit about the American Academy of Private Physicians, the AAPP. We're an organization of physicians who love working directly with their patients. We love it that we have the time and the energy to devote to each individual patient and their specific needs. At this time, I'd like to give you some idea of why that's terribly important, particularly in the political and legislative atmosphere that has come to pervade the media and some of the practice of healthcare in 2009 and now in 2010. My patients need medications many times. They need medications for them personally, individually. First of all, they may already be on medications. So when I choose a medication for my patient, I do it very demonstrably, having their entire history in mind, knowing where we're going with that medication. What is the mission, basically? What am I trying to accomplish with the patient by giving them a medication? Sometimes that medication may be a brand name drug. Sometimes that medication may be a generic drug. Obviously, doctors want to spend the least amount of money to get the biggest bang for the medication. Unfortunately, sometimes my patients take their medication prescription to the pharmacy and they walk away either with a medication that I did not intend them to have, a substitute medication, or perhaps even a medication completely different than what I prescribed. Usually, the pharmacist gives me a call, but not always. Sometimes my older patients go home with a medication that doesn't quite look like the medication they were taking before. There's a change in color, a change in pill type. This acts to just confuse my patient. They call me up, Dr. Zwelling, I have the blue pill and not the pink pill, or it's now a triangle or not a circle. What do I do? And of course, then I have to call the pharmacy and find out what's going on. You know, there's a reason that patients pick specific physicians, and that's because they trust us as their individual physician to take care of them, the specific patient. And there's a really good reason we choose the drugs that we do. It's because it's in the patient's best interest. And again, I emphasize that certainly cost is part of that picture. But you can imagine the potential harm that can happen when a patient goes to the drugstore and gets a generic medication that may not look like the old one. Well, the patient thinks they take a pink pill every day, and now the pink pill isn't in their armamentarium of medications, and they don't take the pill. Now they're without the drug. They don't understand that there's one drug substituting for another, and sometimes anything from their blood pressure going up to even a heart attack can ensue. Secondly, imagine a patient takes a medication after I've spent a half an hour, and believe me, our doctors in the American Academy of Private Physicians have the time to spend with their patients to explain the nature of the medication, why we're choosing it specifically, what we expect to happen in terms of complications and benefits, and the patient goes home with that in mind. So imagine when they go to the drugstore and they get this new drug and none of those things happen. They call me up and they say, Dr. Zwelling, this didn't happen or that did happen. I, of course, under the assumption that the patient is taking the drug that I prescribed, decide either to stop the drug, increase the dose, decrease the dose, try another medication. And if that is not based on fact, then I am actually party to hurting my patient. I will never put myself into that position. That's why I insist that when the patient go to the drugstore and pick up their medication, they understand that there is a specific drug that I have prescribed. It's a generic or not. It may be a brand name. It may be a specific brand name, specifically again because that medication does something very special. Let me use an example of statins. There are many statins. These are the drugs like Lipitor and Crestor and Provocol, medications that have completely changed the arena of cardiac care. We are saving lives hand over fist with these medications. But some of the medications are lipophilic, meaning that they're more akin to a fatty environment, and some of them are hydrophilic, meaning they're more akin to a water environment. Some of them are more likely to cross the blood-brain barrier. Some are more likely to decrease triglycerides, and if that's important, it would be a sin for the patient to go to the pharmacy thinking that their triglyceride level is going to go down, when in fact they got an entirely different drug and nothing happened to their triglycerides. Then, of course, you go to increasing the drug when in fact all that needed to happen was that the patient get the right drug when they walked into the drugstore the first time. I really find it insulting when the pharmacist calls me and says, Dr. Zwelling, I'd like to change the medication from medication A to medication B. Is that okay? What do they really expect me to say? After I've just spent 30 minutes explaining to Mrs. Smith about the nature of the medication, why it's so important that she get this medication, and then does the pharmacist really expect me to say, never mind? I don't think so. Not going to happen in my practice, and probably not going to happen in other practices where physicians work directly for their patient, not for the drug company, not for the insurance company, and not for the government. The American Academy of Private Physicians is proud and honored to serve our patients. We are our patients' doctors. We want to continue to have that relationship. That patient-physician relationship is central to everything good that happens to healthcare. And we are here, and we will be here from now and for the following decades to make sure that America's patients have America's finest physicians available and ready to serve at their will. Thank you very much. And from the American Academy of Private Physicians, we wish you a wonderful day. Take care now. Bye-bye.